Hi everybody, welcome to Healthline. I am Gregory Zarian, and tonight the conversation is all about sports medicine. We decided to bring you the best and the best with the best of orthopedic surgeons here in Glendale. Joining us on my right and right all the way down to the left are Dr. Hoji Lee, family practice and sports medicine doctor. To his right, orthopedic surgeon Dr. Michael Abdulian. Next to him, orthopedic surgeon Dr. Vahan Sepkinyan. To his right is Dr. Carlo Orlando, orthopedic surgeon, and to his right is Dr. Christopher Lee, orthopedic surgeon. Gentlemen, great to have this, I'm going to say rock star team of surgeons here. Are you guys doing well?
Yes,
Thank you.
Thank you for having us.
Starting from here to the right, what is your specialty, doctor?
Yes, I started with family medicine board certification. Now I also did a fellowship in primary care sports medicine. I grew up in South Pasadena locally, so after training I came back to this neighborhood.
Welcome back.
Thank you.
Dr. Abdulian.
So I did my residency at Case Western in Cleveland, and then after that I came here to USC, did a sports medicine and shoulder fellowship, and during that time I also trained in hip arthroscopy.
Dr. Sepkinyan.
I did my training at LA County USC Medical Center, both for medical school and for residency. Started practice in Glendale about 9 years ago. I concentrated a lot on just mainly general orthopedics, do a lot of fracture care, and been doing a lot of joint replacements, mainly knee and hip replacements.
Dr. Orlando, since we've done this quite a few times.
I also trained at USC. I've been in the Glendale area for 20 years. Board certified in orthopedic surgery and sports medicine. And I like to specialize in injuries about the hip, shoulder, and knee.
And last but surely not least, Dr. Lee.
So I'm also an orthopedic surgeon. Did my training out in Boston at Tufts, and then I did some fellowship training in San Diego. I basically specialize in orthopedic surgery, joint preservation, sports medicine, a lot of preventative measures, trying to avoid surgery and stuff.
I'd love to hear that. It's all about avoiding surgery.
Yeah.
And as I said, I decided to bring you the best and the best. So for any of you that are suffering from knee, hip, joint, any questions, you will get your answers today. A hot topic, and we were talking about this before we started filming, PRP. What is PRP, Dr. Orlando?
PRP stands for platelet-rich plasma, and it's probably been around for 7 or 8 years, maybe even 10 years. It's been called other things prior to that, but essentially what it is, it's an injection. We take blood from the patient, not much, usually about 10 cc's of venous blood. It's spun in a centrifuge, and then you separate out the plasma from the white blood cells, and the plasma has the platelets. Platelets have a lot of different growth factors that stimulate healing and growth. And the idea is you can inject this into the injured site, the fracture, the torn tendon, and it stimulates healing. It's a hot topic. It's being studied internationally. A lot of the professional athletes are having it done right in the locker rooms. But what's really being done in other countries is things that we can't do in the United States yet, is they're further filtering the platelets in the plasma and separating out other components that are better than others for stimulate healing. And that's where you hear about some Kobe Bryant, Tiger Woods flying to Germany and having these, they're PRP injections, but they're super PRP injections.
But here's the thing. It's basically your body healing itself.
Yes.
So it's your own blood
Yes.
making you stronger.
Yes.
Why, Dr. Abdulian, why is it such a conversation?
I think it's a big conversation because it's, like you said, it's a hot new topic, and we have seen some good results, but I think that we're still learning more and more about it. But it makes sense that you take all the growth factors and you take it in a very concentrated fashion, and you inject it to the site that is inflamed or is torn or is injured. So it's basically like taking a lot of resources and putting into one spot, whereas you have those platelets in your blood, but you have a certain level of it in your blood. We're basically increasing that level to a super therapeutic amount to provide all that. And I think we're learning more about it.
Dr. Sepkinyan?
One thing we have to realize, though, it shouldn't be, some people are marketing it as a cure-all and using it as a replacement for possible surgery or other modalities of treatment. And that's where you run into some problems on expectations.
And more conversations.
And more conversations about
that's where it goes
this.
in more pause.
That's where I think some of the controversy comes in, where if you have a patient with, let's say, end-stage arthritis of their knee, and they put all their hopes in something like this, where you would inject platelet-rich plasma into the knee, The only thing that's been shown with the knee specifically is that it may relieve some of your pain, but it does not reverse the course of the disease.
So it's not a cure-all.
Correct.
It's a possibility.
Correct.
It's an adjunct.
It's an adjunct.
It's
So
an
it goes
adjunct.
it goes along
It-
with.
It enhances healing, but it is not, people are grasping straws, like Dr. Sepkinian said, been told they need a knee replacement, and they want to try PRP. And it's a complete waste of money and waste of time if they need a knee replacement.
Because a knee replacement
It's
is
bone
you
on
need-
bone, the knee's
Got it.
completely worn out. But it's for injuries that are otherwise a healthy knee, healthy tissue, healthy whatever you're talking about, and there's a localized area of damage. We can inject that into the area, spray it over the area, and it's being studied. I mean, there's a lot going on right now, and we're learning a lot. So it's not perfected yet, and the studies are looking promising.
Good.
And but some people are they grasp at straws, and sometimes it's just it can be a waste of time in some people.
Well, here's also one thing that I'll say is too is because you're doctors and I'm a patient, we look and in a weird way we make you our answers, I want to say God. We're like, okay, gods, help us with this. So we need something to get us to the next level if we're hurt, or maybe somebody doesn't want knee replacement, or somebody doesn't want hip surgery. They want something as an alternative. Dr. Lee, you were going to say something.
Things like PRP, I think all of us are doing it. They're all great. But you have to understand a lot of these measures are temporary. And what really can cure patients often is paying attention to alignment, posture, having a really good trunk strengthening. A lot of us, PRP is great. It should never be the first line treatment. Physical therapy, if you have shoulder pain, working on your posture, getting your shoulder blades better. All of us, we're always hunched forward, so you want to work on getting better posture. If you have knee pain, look further up. Make sure your hips are strong, work on your glutes.
Stand in proper alignment.
Yeah, a lot of us, we keep working on our core. We forget about the back. And you got to have a really strong back, you got to be balanced. So things like that can often be even more important than adjuncts like PRP, steroid injections, anti-inflammatory. Paying attention to alignment, posture, good trunk strength. To me, strength is everywhere from the lowest rib to your knees. If you can get this whole area strong, front and back, you can have a lot of
As I sit up straight.
results.
Dr. Lee?
Yes, I think Dr. Lee as well as said, basically you need to speak to your doctor. What's going on? What's the underlying cause of the problems? Once you fix the problems, maybe you don't need all these measurements. Maybe you could do just simple as physical therapy and posture training, simple things like that. Even people daily work in the office, they complain of shoulder pain, neck pain, but it's really maybe the computer is looking down this all the way down here, or their desk is sitting facing this way, but the computer is over here. So they're sitting for hours like this at the same time too. And even like everyday golfer, tennis players, they got tendinitis. So you got to think about what the underlying cause is. And once you fix that, I think, there's primary care benefits and preventative measurements as well as too.
When we come back, we'll talk about the shoulders, the hips, and the knee, and more on how to keep yourself aligned. Don't go away. Welcome back to Healthline. I am Gregory Zarin, and I hope all of you are sitting up straight. Shoulders back, feet planted, knees, hands, everything just like this. Deep breath in and deep breath out. It's all about sports medicine and keeping yourself aligned. And again, from my right all the way to the left, joining me in our family practice, Dr. Lee. Orthopedic surgeon, Dr. Abdulian, Dr. Sepkinian, Dr. Orlando, and Dr. Lee. Again, I brought you the best of the best in sports medicine. Dr. Lee, you started off when you introduced yourself, immediately went into prevention. Do you find that most people aren't about prevention? They immediately want to go into surgery?
Yeah, unfortunately, we see that a lot, and it's not even just surgery. A lot of patients, unfortunately, in our society these days, everything is instant, injections,
Quick
medication, a magic pill, and we don't have that. So when we see a lot of our patients, the first thing we look at, we talked about alignment already, we look at posture, we look at where your strength and balance is. A lot of times our physical therapists, we work together with our therapists. If a patient's having pain running, then what we do is we have them run, and we take a high-speed video of it, and we slow it down. We see where do they have a strength deficit. If we can correct that, and that takes several weeks, sometimes months to correct, these patients will get better, and that's a lot more of a long-term fix. So, yeah, we were talking about this before, where 90-95% of the patients we see, we pursue conservative measures, whether it's home stretching or seeing a physical therapist. We can get a lot of people better without surgery.
Well, because if you're sitting, as you were saying earlier, Dr. Lee, if you're sitting at your computer like this, it just doesn't happen.
Right.
We're looking at 8 to 10 hours a day where your alignment is off. And we all talk about, not we all talk, but people talk about sitting ergonomically in your chair. What is the appropriate way to sit in your chair if there is a computer? Because a lot of people have office desks. What is the right way, Dr. Sepkinian?
Well, the right way to, well, first of all, you have to be quite comfortable. There's no specific stiffness for any type of chair that you're going to be on. You have to make sure that your keyboard is at a specific height where it is at a height where your fingers are flat with the tabletop, not
Like this, okay.
flexed this way where you're putting a lot of pressure on your wrists and where you have to constantly maintain this flexed position in your elbows. Also, you need to make sure that your screen is mainly right in front of you, not off to the side, so you're not really stressing your neck. Also, it goes to besides the computer desk, you also have to make sure that your phone is easily accessible. If you're working in a clerical position, you can't keep the phone on your neck for an extended period of time.
I wear a headset.
Headsets
I do.
are quite essential. Another thing that, just to touch up on what Dr. Lee was talking about, yes, we're surgeons, but that doesn't mean any patient that walks into the office doesn't mean we're just going to be we've decided to cut on them, or their primary care physicians.
Thank you for coming in. I'm going to cut you open.
Okay, or their primary care physicians have referred them to us. It doesn't mean that they're committed to a surgery. As you touched upon, a great majority of our care is in conservative measures. Operating is a privilege for us, but we're not just knife-happy people who say everybody is a surgery we're just waiting to happen. If we can have our patients comfortable and symptom-free without having to do a lot of procedures, that's very good, and you have a happy patient.
I love that, Dr.
I tell
Orlando.
patients frequently about the ergonomics. There's a lot of things that can be done, and there's specialists that can come out and check your workstation and all of that. But I tell patients, be comfortable, but drink a lot of water. Every 30 or 40 minutes, you got to get up to go to the bathroom, and you're taking a break.
You want to stand up
and
and
you get up and
stretch.
you move around and this or that. And I agree with both of the doctors to my right and left that we only operate on a small fraction of the patients that we see. The majority of the time, surgery is always the last option, except in an emergency.
Sure.
But the majority, the vast majority, is not surgery. So, and we do our best, to make that the last option.
And one thing, too, that I want to throw out there, too, in regards to drinking the water, a lot of the times that we have headaches, it's because we're dehydrated. And a lot of times that we think that we're hungry, we're actually thirsty.
And there's probably a lot of coffee drinking, a lot of caffeine, and so hydration is important in the workspace, too.
What are your thoughts, doctor, in regards to people that just don't do what you tell them to do? Since we talked about sitting upright or drinking water and physical therapy and preventative, I'm sure, Dr. Lee, you get a lot of this. What do you say to those patients?
Well, I think my approach to all patients is, our goal is to help you, but it's not one of those things where, the surgeon or the physician does all the work. It's a team effort between patient and doctor. So I always tell, patients, these are the recommendations. So say someone has joint pain and I think that physical therapy is going to benefit them. I always tell them, you really have to try it. It's a daily thing. You got to give it its effort and you got to do it. I think that more and more people in our community, our patients, need to start taking some ownership of their care. We take our car to the mechanic and we just say, fix it. I wish it was like that, but it's not. I talk to my patients and I say, I think this treatment can help you, but you got to give it its chance. Just like Dr. Lee said, unfortunately, we don't have a quick fix. We don't have a magic pill. We can't just do things instantaneously. So that's what I tell them. I say, let's work together, but both of us have to put in the work.
True. It also makes me think of the person that's put on 30 pounds and they're watching TV chronically as they are eating their pizza and eating their ding-dongs and donuts. And they're like, I don't know how I put this weight on. Well, yeah, you do.
Well,
you know exactly how that happens.
That's very true. I think obesity is an epidemic in our country.
Over 70% of the country.
Yes, and that basically leads to ailments like arthritis, which is also the greatest cause of disability in our society. So we can, like Dr. Abdoulian said, we can only certainly provide the guidelines. You can't force somebody. You can't force somebody's will. Whatever choices they make, you try to provide them with the guidelines so that they can they can resolve their pathology.
Well, I love that you said it's a choice, because everything we do is a choice. Doctor, your thoughts on this?
Yeah, I mean, every day we tell people just even simple as 30 minutes simple walking will do a lot.
Minimum 150 minutes a week.
It's not a big deal. You sit there for hours watching TV. Why can't you just go out there just for 30 minutes, walk a dog, take your family with you, go for a walk with your kids instead of kids are on the computer, iPad, people are on the bed looking at iPads. They come back next day, I have a shoulder pain, neck pain as well too. But I ask him, what are you doing that's causing pain? He's like, I don't know, but it's been bothering me. But at the same time, I look at my mom as well too. She's like, I got neck pain. I don't know why. But I see her watching TV, but at the same time using the iPad, doing this, things like that.
However,
they don't realize that.
However, I'm high point scorer on War of the Worlds gaming, because gaming is a pandemic. Okay, so here's the deal. Get up, go out, take a walk. Everything we do is a choice. And my choice is this. I promise you that when we come back, we will discuss hips, knees, and shoulders and give you solutions, and we will address some of the surgeries, because we also brought some show and tell. Get a glass of water. More when we come back on Healthline, and our conversation is all about sports medicine. Don't go away. Welcome back to Healthline. The conversation's all about sports medicine, and we've talked about drinking water, getting up and getting out, putting down your iPad, you're turning off the TV, the computer. And here's the reason. There's a reason why the United States is one of the most obese countries in the world. Over 70% of this country is obese. We talk so much about health and wellness, however, we can't put down the ding-dongs. We can't quit drinking our diet sodas. And we look in the mirror one day and we've put on 40 pounds. Here's a quick way to lose weight, as one of our doctors said. When you get out of the shower, look in the mirror. If you don't like what you see, I'm sure somebody else is not going to like what you see. So, bottom line, it's all about your health. It's all about making healthy choices. If you find that you are hurting or suffering or sitting poorly, it's the way you do it. So if you're going to sit like this, why don't you just take an extra moment and sit like that? Joining me are the best of sports medicine doctors here in the Glendale community. Guys, we've talked about PRP. We've talked about sitting in proper alignment. Some of the maladies are shoulders, hips, and knees, and even feet. However, shoulder pain. What is some of the common reasons that we have shoulder pain, Dr. Abdoulian?
So it could be a variety of things. One thing I always like to look at is shoulder mechanics. Sometimes if your shoulder blade is not working properly, it can cause pain. Joints are dynamic. There's a lot of muscles crossing them. So if they're not working properly, you can have that causing pain. Sometimes some of the muscles and tendons that are in the shoulder joint, across the shoulder joint, they can get inflamed, and so they can get irritated, like your rotator cuff tendon, your biceps tendon. And then sometimes right where that rotator cuff is, you can get what they commonly call bursitis, which is just inflammation of that rotator cuff tendon and the fluid-filled sac above it. And arthritis, it's a joint, so wear and tear of the joint can cause shoulder pain. These are some of the very common things. I'd probably say that this is what causes 80 to 90% of shoulder pain that we see.
So, Dr. Lee, what are some healthy solutions in regards to bursitis and shoulder pain?
Basically, I tell them, first thing I ask is, what do you do?
Okay.
Either are you a student? Do you work? What kind of position do you do? If you're behind a desk, where is the computer? How do you sit? Those are just simple things I ask. Other thing is, are you right-handed, left-handed? Do you do recreation or any sports? At the same time, I tell them, while I'm talking to them, I look at their position as well too. I can see that they're slouching, they're turning this way. They have a phone here. Simple things that you could observe even before just talking to them as well too. So it's all about education.
Education. Go ahead.
So I tell them at the end. I tell them basically, I saw you while I was talking to you. I saw your positioning. I see that your habit, you do this without you knowing it. So simple things, corrections. One of the doctor mentioned here having mirror. Look at yourself in the mirror and see how you stand when you get out of the shower. Some people do slouch. Some people don't do this, and maybe some people do that. So it's all about their behavior, body positioning without them knowing it. So that's why you come to the doctors. Once the doctors assess it, you tell them to simple things as simple corrections, and they do well even without physical therapy as well too. But when they come to my office, I also give them a handout about what bursitis is, what's arthritis is, tendinitis.
So you let them know what everything is.
I give them a handout. I give them a homework as well too.
Oh, good.
At home.
Because just going into your office is not going to fix everything. Dr. Orlando, so you have the bursitis, you have the pain. What are some remedies for that then? Outside of stretching, because stretching, my shoulder was hurting and my trainer said, just stretch this out and it's better.
Well, good. Important thing is what happened. It's important to know. Is this an injury or is this overuse? You have to differentiate that. But by far, the majority of the stuff that we see is just shoulder pain from a simple sprain or a strain. It could lead to bursitis or tendonitis or a partial tear. And treatments are avoiding the activities that aggravate the symptoms, anti-inflammatory medication.
Such as?
Aleve, Advil, things like that. And patients say, it just takes the pain away. Well, it's not. No, it actually deals with the inflammation.
Okay.
It's dealing with the fire, not just the smoke. A painkiller takes away the smoke, but the fire is still smoldering.
I love that.
The anti-inflammatories are helping with the inflammation. And then there's physical therapy, and the majority of simple sprains and strains and the majority of the shoulder pain that we do see gets better 5, 6, 7 months with rest and time and restricted activities. Now that's different if there's a dislocation or a sports injury where they fell off their bike or something and have a fracture. That's a lot different.
And that turns into physical therapy and sometimes surgery.
Yes.
So most times with the shoulder, it's just about sitting properly, paying attention to everything that you do, stretching, but also some people can just live on Aleve and Advil and stuff, which is not
Which
great.
is not really recommended.
No. Okay. Let's drop down to the hips. Dr. Sipkinian, common hip pain, what is that?
With regards to hip pathology, if we're talking strictly about sports medicine, hot topic right now is basically the soft tissue surrounding a hip joint. A hip, basically something referred to as a labral tear, or where you can get tearing of the surrounding lip of tissue that holds the head of the hip in the socket. And in orthopedics, we developed a minimally invasive procedure, something referred to as an arthroscopy, where basically a camera is inserted into the hip joint, and these types of injuries can be treated with that. Other hip ailments, again, like Dr. Orlando said, a great majority of them are simple strains. You can certainly strain a lot of tendons that cross the joint, that stabilize the hip joint. It's pretty well covered. And the treatment for that is usually conservative, using anti-inflammatories, proper stretching, strengthening of the musculature, also your trunk. This is also very age dependent. As we get older, the cause of hip pain change. As we get older, our joints do wear down depending on our activity level. And you can develop arthritis, and treatment for arthritis starts out conservative, but there's no cure for arthritis. And down the line, if the arthritis does get worse and you've exhausted all appropriate conservative measures, then you may need possible surgery.
And that turns into hip replacement.
Hip replacement.
And full hip replacement and partial, right?
Well, for hips, it's usually a full hip replacement. There is something also referred to as a hip resurfacing.
Okay.
However, again, that's an area of controversy because of the components that are being used, but usually a hip replacement is what is the end point for very severe hip arthritis.
And Dr. Lee, thoughts on hip replacement surgery?
Hip replacement is a great operation. Certainly just because you have arthritis doesn't mean you need a replacement. When we see a hip, we focus a lot on range of motion. When patients have some sort of injury to their hip, the most common, because I'm in a sports practice, so the most common injuries I see are more overuse. I see a lot of tendonitis. I see a lot of tendonitis in the front of the hip flexor, because a lot of the runners, every time they pick up their leg, especially going up and down hills, they'll kind of, if they get tight in the hip flexor, when you're doing activities, you're tearing muscle fibers, and those
Sure.
heal with scar. So stretching is huge for hips, getting the range of motion, and then strengthening. Once you're stretched out, your pain's a little bit better. We really pound strengthening. For the hip, we work on a lot of what we call the gluteus muscles, both muscles that go out to the side, muscles that rotate and go backwards. In everything we do, we're always going forward. We walk forward, we run forward, playing basketball, you're jumping, that's propelling yourself forward. We lose the side-to-side movements and going backwards. So that's where I'm talking about the balance
Got it.
again. We see people are too strong and tight in the front, too weak and loose in the back. So we tighten up the back by strengthening, and then we lengthen the front. So strength and lengthen. Everything is strength and lengthen.
Oh, I love that strength and lengthen. And as you were just saying, we're going forward to our last break, and when we come back, we will address the knee, and final thoughts on sports medicine and how to keep yourself healthy when we come back. Do not go away. Welcome back to Conversations All About Sports Medicine. We've talked about the shoulder, we've talked about the hips. Gentlemen, the knee. Dr. Orlando, during the break you were talking about most arthritis ends in the knee.
Yeah, the most common arthritis is probably the hands and feet and the back, but the most that we treat with surgery is the knee, then the hip, then the shoulder. Arthritis of the shoulder is actually very rare.
Okay.
And we do more knees than hip and shoulders combined, probably.
So more knees treated than hip and shoulders.
For arthritis.
For arthritis. What are some of the maladies with knees? I know there's meniscal tear. What else are there?
The most common thing is probably what we call patellofemoral
Okay.
mechanics, the kneecap. A lot of times your kneecap will lose its alignment because of imbalance in strengthening. I hate to keep saying it, but it's
No, I'm glad that you keep on saying it.
Weakness in the glutes, weakness in the quads. We used to think everything was quad oriented, but we were wrong. It's actually your glutes. If you can get your glutes, which is really the rear hip muscles, stronger, you can take a lot of pressure off of your knee. It's all about balancing shock absorption. If you're using your knees to absorb 90% of the shock, they're going to hurt. If you start recruiting that hip, then you split it maybe 60 and 40. You're taking pressure off of the knee. It's immense.
So it goes back. And Dr. Kenyon, you brought a show and tell piece.
Well, this is
Real quickly, can you just share with us what that is?
Sure. Well, this is basically what a knee replacement looks like. It's a
Okay.
left knee replacement. This is the end of the femur bone or the thigh bone, and this is the top of the tibia bone. And these little rubber bands are basically tell you where the collateral ligaments are. And knee replacement basically is just replacing what God gave you and replacing with artificial components, namely metal and plastic, to put it very simply. And you're basically getting rid of all the arthritic pain-producing surfaces and replacing them with artificial components that just give you better alignment, and you're able to walk on it without any type of pain.
And there's also a procedure that we've talked about, Dr. Orlando, the Mako procedure.
And we're getting so specialized, we don't have to replace the whole knee.
That's
We can
fantastic.
replace just one component or one part of it or two parts of it.
And that's
instead of the whole thing.
resurfacing. What are some supplements that people talk about all the time in regards to joint health? Glucosamine is one of them. Are you a big advocate of that?
I am actually. I tell people ask me as well too. Does it help? Sure. I say it doesn't hurt to try. Give it a try twice a day for every day though, not on and off when it hurts.
Be
But you
committed
got to
to
try
it.
committed to it at least 2 to 3 months. If it doesn't work, you don't notice any difference, then you could stop. But it doesn't hurt to try.
And along with that, though, it's not just taking the glucosamine or taking the Advil. It goes back to everything we've talked about sitting up, alignment, being very intentional as to what you do.
Weight loss.
Weight loss.
Will prevent a lot of long-term degenerative pathology.
It becomes a catch-22 though. A lot of patients are trying to lose weight, but they can't exercise because their knees hurt.
That's a great question.
Well, if they do low-impact exercise and make sure that their calories in are less than their calories out, then they could still lose weight without having to impact the joints.
I love that.
Weight
Good.
loss is 80% nutrition.
It is.
Yeah, weight loss is 80% nutrition. The other 20% activities. So I stress that to all my patients. And sometimes, weight loss is very difficult. And if patients need help, we have a lot of resources to help them with that.
I love that.
Counselors.
Because people think, oh, I can't do this, I can't do that. Yet you said there's lots of resources.
I'm sure every one of us at some point has tried to lose 5 pounds. It's really hard, so we understand that.
Eating's a habit. It's a behavior pattern. So you need to adjust that. So he's right. Nutrition, if you get a nutritionist to help you balance your diet and you stick to it, you get a journal, it makes a big difference.
And
Start reading labels.
And majority of and also when you shop on the outside of the grocery store, it's healthier. Doctor, final thoughts?
Final thoughts, these treatments, physical therapy, weight loss, they're not overnight things. Be committed, be patient. No one lost 20 pounds overnight, but if you do your physical therapy regularly, you make it a routine, 6 months, 4 months, I'm sure you're going to see results and you could avoid surgery.
Doctors, it was an absolute pleasure, and I appreciate your time and I appreciate your expertise. So, bottom line is this: you're the captain of your ship. If you want to make a change, the choice is in your hands. All of these doctors' information and contact will be listed at the end of the show. And here's my final thought. Remember, the most important conversation you are going to have is about your health, so why not make it a healthy one? Last time, take a deep breath in, deep breath out, feet planted, shoulders back, gut sucked in a little bit, go back to your core. Have a great night. We will see you next time here on Healthline.